Hi, I'm Dr. Narda Robinson, President and CEO of Curacore Integrative Medicine and Education Centers. Here we'll go through an overview of the photomedicine course and then look at each module individually to see what the contents are. Let's take a broader perspective to begin with. So we have 12 online modules with 50 hours of continuing education. And as we start, we'll just do an introduction to photobiomodulation and talk about some of the devices and controversies. If you've been around laser therapy at all, you've probably heard about the disparity in views between Class 4 devices and Class 3B, even the Class 1M devices. So we'll get into much of that during the course, and it's interesting to me to hear input from students that have Class 3B devices and have been through courses on them versus the views that are held by the Class 4 device owners. And there's a real disparity in ideas about whether or not you should use high or low power and whether or not the treatment should be short or long. So if you only listen to sales staff, you'll get a much different impression than if you look at the science. So our goals with this course are to present to you the science and interviews with researchers that are found on the web and papers that they've written, and to really consider where are the facts, because I don't have any laser devices to sell and I don't get kickbacks from product manufacturers. So try to be just as straight as possible to give you the most information to make the best choices for your patients and their care. So with Module 1, we will talk about some of those settings and the, as I said, controversies. For Module 2, we'll be looking at a video. Now for Modules 1, 2, 3, and even 4, we are going to be reviewing videos that had been recorded at a live laser meeting that I had given lectures at. And you will have a different type of engagement with the videos. We had started out trying to use a certain software, giving that an experiment, and you'll have quizzes embedded with the videos. After that, we will return to the Litmos learning system, and I will have separate assessments that you will proceed through and submit for marking oftentimes, because I think it's better to have marked questions where we have the opportunity for discussion rather than just simple multiple choice approaches. So for modules 2 and 3, we'll be looking at photomedicine physiology, how light repairs tissue and then how light reduces pain. We'll take a deeper look at that as we come through the modules. Photomedicine also addresses inflammation, and there are various metabolic changes within the tissue that take place as a result of shining either a laser beam or an LED on it. So LEDs are these light-emitting diodes, and we'll take a look at one device that's been sold for humans with hair loss and see how that works. And it's going to be something of the future, and we already see more LED arrays being sold to consumers directly. So it's something that we don't have to worry as much about retinal exposure and is just much safer. And companies are coming out with units not only of the red LED type, but different wavelengths, which will mean different colors, and even near infrared, and just make it more available for ongoing treatments at home. For the next module, we'll be talking about how photomedicine affects the immune system, and then taking a look at the research and look at the relative strength of photomedicine for various clinical conditions. Then we'll be moving towards the skin and tissue and how we can heal chronic wounds, and then traumatic brain injury, brain disorders, spinal cord dysfunction and trauma, treating peripheral nerve injury with photomedicine, which is very strong, and then getting into more of the clinical applications where I will show you videos of cases and ask you to come up with treatment settings based on things that we've learned during the course. So discussions about wavelength, power, maybe frequencies, but also where to treat. So it's much more than just finding a spot and delivering a treatment there. When we include the whole patient and think about muscular strain patterns and various spinal cord segments, there's a lot more comprehensive approach that we can deliver rather than just a point and shoot over one area. and you'll get better results as a result of that. So getting into rehab and pain practice, and then finally wrapping up with other emerging applications of photomedicine, including photodynamic therapy for cancer, internal organ treatment, and then touching on laser acupuncture as well. So more of a miscellaneous category that we will wrap up the course with. And this course is appropriate for veterinarians and veterinary technicians, but keep in mind we do talk about physiology and some laser physics, some optics work. So if you haven't had that before, it's not like you'll fail the course, but it just helps the more background you have in science.